Recently, David Alaba has been able to resume ball training after nearly a year of being sidelined. Last December, the Austrian player suffered a torn knee ligament and had to undergo immediate surgery. Over the past period, the defender has been actively recovering, but the process seems to be quite slow. Coach Carlo Ancelotti has been very patient with the former Bayern Munich player. Before the injury, he was a key figure in Ancelotti's tactical system, thanks to his excellent one-on-one ability and smart football intelligence. Ancelotti has affirmed that once fully recovered, Alaba will have a spot in the lineup. However, as time goes on, the fans of this defender are becoming increasingly worried, as Alaba's recovery process seems unusually slow compared to typical ligament tear injuries. According to the latest information, Alaba is again experiencing significant pain after returning to ball training. Moreover, a shocking rumor has recently surfaced online. It seems that Alaba's injury is not improving but is actually getting worse. While the ligament has stabilized, the meniscus in his knee is damaged. This is causing pain when his femur impacts his tibia. Ladies and gentlemen, David Alaba faces the risk of never being able to play football again due to the meniscus and knee injury. The knee cartilage cannot regenerate on its own, making treatment very difficult and painful. In fact, Alaba may no longer be able to engage in strenuous physical activity. At 32 years old, the prospect of early retirement is a major shock for Alaba, who is still at the peak of his career and is regarded as one of the best defenders in the world. Why is a meniscus injury so dangerous? Ladies and gentlemen, the meniscus in the knee is a cushion between the femur and the tibia, consisting of two parts: the medial meniscus, C-shaped, and the lateral meniscus, O-shaped. The meniscus is divided into three parts: the anterior horn, the body, and the posterior horn, with two edges, one attached to the joint capsule and one free edge. The meniscus is tough, elastic, and supports the entire body's weight, playing a crucial role in stabilizing the knee, absorbing shock during movement, evenly distributing pressure in the knee, and supplying lubrication and nutrients to the joint cartilage. It helps prevent the joint capsule from getting pinched between the joints. Meniscus tears occur when the knee is subjected to excessive force, causing the meniscus to tear. Small fragments of cartilage can become lodged in the knee joint, leading to joint degeneration. Furthermore, meniscus tears can take many forms, such as longitudinal, transverse, radial, or flap tears. Normally, after a meniscus tear, you may still function as usual, but after a few days, the knee will start to show signs of pain, swelling, and reduced flexibility. At this point, it is necessary to see a doctor immediately for a diagnosis and appropriate treatment to avoid prolonged complications. There are three specific levels of meniscus tears. Grade 1 meniscus tear, also known as lateral meniscus tear. This is the area with abundant blood supply. If detected early, it can still recover. Grade 2 meniscus tear. This is the intermediate area, where blood supply is gradually reduced. The tear may heal, but not as effectively as Grade 1. Grade 3 meniscus tear. This area has no blood supply, and the tear cannot heal on its own. Surgery may be necessary to remove the damaged part. For these three levels of meniscus damage, if you do not seek timely treatment, you may face serious complications such as increased knee pain, difficulty and pain while performing movements like walking or straightening the knee, quadriceps muscle atrophy. When this occurs, the patient cannot walk or straighten the leg. Knee joint degeneration. The knee becomes unstable, prone to degeneration, and may be completely damaged. Recovery time from a meniscus tear varies from person to person, depending on the injury's condition and the treatment method. It is best to follow the advice of doctors and the medical team strictly. Additionally, you should not overuse the knee right after treatment, as the injury has not yet fully healed, which could result in recurring pain or further injury. A meniscus tear may heal on its own if the tear is small and located on the outer edge with a good blood supply. However, in some serious cases, surgery is required. Based on the diagnosis, the doctor will determine the severity and decide if surgery is necessary. Clinical diagnostics for meniscus injuries include arthroscopy to assess the extent of meniscus and other knee joint damage, X-rays to detect joint space narrowing, MRI to detect associated injuries in other areas such as the anterior cruciate ligament, meniscus, posterior cruciate ligament, or collateral ligament, After the examination, based on the tear's location, size, and shape, the doctor will provide an effective treatment plan. Meniscus tear treatment methods include non-surgical treatment. For small tears in the outer third, close to the joint capsule, with a rich blood supply. Treatment methods include physical therapy to reduce swelling, joint stiffness, and restore knee function, pain relief and anti-inflammatory medications. Surgical treatment of meniscus tears. When the damage is severe and physical therapy or medication is ineffective, surgery is necessary. There are two methods. Open surgery. Removal of the damaged meniscus, applied in cases where the tear is in the avascular area, inner two-thirds, and the tear is older than 6 weeks. Arthroscopic surgery. Meniscus preservation stitching is recommended for longitudinal tears less than 6 weeks old in the outer third, close to the joint capsule. This method helps minimize meniscus removal, reducing the risk of joint degeneration and extending the knee's lifespan. Arthroscopic meniscus surgery is a minimally invasive treatment method that allows patients to recover quickly after surgery while maintaining aesthetics. Arthroscopy is used to remove the torn part of the meniscus and stitch the meniscus through the arthroscope. Remember that meniscus injuries are among the most common in football, accounting for 12% of injuries in the English Football League system during the 2004 to 2005 season, according to Fishroom statistics. Only muscle, 33%, and ligament, 31%, injuries occur more frequently. Statistics show that most meniscus injuries in football require surgery, combined with physical therapy to restore knee function. However, it is concerning that meniscus injuries are prone to recurrence. Because of this characteristic, sports physician Marco recommends that players focus on injury prevention rather than relying on cutting, stitching, or grafting the meniscus as a treatment. Accordingly, players should reduce knee stress by maintaining a balanced training, competition, and rest schedule, and not push themselves to play throughout the season. This is unfortunate news for David Alaba, a player with a stellar career, having won the Austrian Footballer of the Year award 10 times, 4 Champions League titles, 2 with Bayern Munich, 2 with Real Madrid, 10 Bundesliga titles, 2 La Liga titles, and many other major and minor trophies. As for Real Madrid, the club is actively searching for reinforcements for the defense, as Alaba is injured and Antonio Rudiger is also showing signs of aging. Gabriel Magalhaes from Arsenal and Christian Romero from Tottenham are currently on the Champions League champions shopping list for the summer of 2025.